Well, good afternoon, everyone. My name is Kristen Burke, and I am the National Marketing Coordinator here at Art Jetter and Company. And today we're going to be talking about leads and really kind of getting you ready for Medicare AEP. That's just right around the corner. We have the privilege of having Chris York from Kramer Direct joining us today and really giving us some good insight of how to make your AEP season very successful. So I've had a long relationship with Chris. He's a great guy, and I think he's going to provide you with some great insight. If you have questions during the presentation, feel free to type that into your menu bar, and we will address those questions at the very end. So at this time, I will let Chris take it away.
Hey, thank you, Kristen. I really appreciate the opportunity to work with you and the rest of your group there to talk to your agents. So thank you for making this possible. And you're right, we have known each other far too long. We're not going to let anybody know because then they'll realize how old we are. So it's okay. But hey, thank you very much. So yeah, my name's Chris York. I am with Kramer Direct, and I do appreciate the fact that Art Jetter and Company are giving me the chance to talk about helping you with probably the most important part of your business. You know, as independent insurance agents out there, you are all responsible for generating your own business, your own leads, and we are fully aware that that is probably your biggest single expense that you have. So while certainly I will be happy to talk about some of the stuff that we do at Kramer Direct, I'll mix that up. This is by no means going to be a commercial. What I'd like to do is give you guys some information on the best way and the smartest way, I think, that you can purchase your leads, certainly during AEP, to get the biggest bang for your buck. Certainly would love to have you do business with us. If you already have another vendor, that's okay as well, but we would love to be able to work with you. So, hang on, got to go back up. There we go. So, sorry, there we go. So, first of all, if you're doing business with Kramer Direct now, thank you very much. We appreciate the business that you do with us, and we enjoy that. If you're not doing business with us, I'll just tell you, we've been around for 35 years, which if any of you have been doing this very long, you know that's a lifetime for lead generation companies, and you know, stay that way if you're doing it right. And we just work with agents like you every single day, as I said, trying to help you really do a good job promoting your business, promoting your leads, and get the biggest bang for your buck. And one way that we're going to help do that is, thanks to the folks there at Art Jetter and Company, is we're going to give away a 1,000-piece mailing to the people who are on this webinar and the one we did on Thursday. And it's really pretty easy. All you got to do is, number one, know that we're going to use our double postcard format, which is our best performing piece. It's going to include standard data, which is basically you're going to be able to pick age, income, geography, type of product you want to market, that type of thing, but it'll be standard data. The good news is that the fact that you're already registered in the event. Kristen, have I lost control again? I think I have. So the good news is that it's going to be based on your registration information. It's one winner for all webinars. All you got to do is stay on the end. So the fact that you've made it here, you've registered, got through it. We're going to draw the winner tomorrow, and I don't know about you, but I always hate it when people give out contests and they never say, hey, congratulations, who the winner was, and announce it, because you just never know. So we'll walk through that. I think the thing I found on Tuesday, the other thing, and certainly Kristen can address that as well, one of the things that also happens is I think you have to have at least one contract under Art Jetter and Associates to be able to qualify for it as well. So Kristen, somehow or another, there we go. It's working now. We're getting through there. Thank you. So let's get started. Let's talk about AEP. You know, it's kind of the best of times and the worst of times in an agent's life, right? You know, there's just a lot of things going on. We know that we have the opportunity in a very compressed period of time to generate a lot of business, but we're also having to run around and try to preserve our own clients as well. So but you know, if you do it right, and you plan your marketing and you coordinate your strategies and do that, is you really have a chance to have a very, very successful AP and really grow your business a lot during that compressed time period. So there's two things about AEP I know. Seniors increase their shopping through Thanksgiving. It's been that way almost from the beginning. People start shopping, they shop, and generally around Thanksgiving, they're through shopping. So what we find is that's when people get together at Thanksgiving, they talk to their family, they talk to their friends, they do whatever, and really that's when a lot of the shopping does. There's still, buying does. There's still some shopping that's done after Thanksgiving, but one of the things we'll talk about is the time to be in the mail to get the biggest bang for your buck. The other thing is we know they're just bombarded by offers. Look, there is just a lot of noise that goes on during AEP, and you think about it. Their mailboxes are absolutely, totally jam-packed. I'm having some issues here with my internet. I apologize, guys. So we know they just got a lot of noise. Think about it: the average senior gets during AEP, the average senior gets about 27 pieces of mail. A lot of those are from their current provider. They get that, but they just got a lot of noise. So there's just a tremendous amount of noise in the post office box. They go through it. Kristen, for some reason, there it is. I apologize, guys. Technical issues are always fun when we go through this. The other thing is people talk about that emails are a good way to do business as well, but emails are just totally packed full now, so you've got to find a way to really cut through that noise. And the best way you can do that is certainly to plan ahead. Look, it's already August 1st, and you really need to start thinking about October 15th when AEP starts and what you can do. So it's really time to start now. There's a couple of reasons for that is that you really want to think about the products that you want to market and really what your strategy is going to be. When I talk about products that market, on this webinar, we're primarily going to talk about two products. Certainly Medicare Advantage is really the reason AEP got there. But folks, it's a great time to sell Medicare supplement insurance. You know, there is more Medicare supplement insurance sold during AEP than any other quarter of the year. So a lot of people are out looking at plans well. So think about the products that you want to market. Also identify your goals. And by identify your goals, listen, think about, look, what products am I going to market? What are my lead generation going to be? What kind of mix of business am I going to do? Just really begin to plan about when you want to be in the mail and all that. Okay? We also know, again, look at this chart about when seniors shop. So on part of this chart, you see this one starts really like in mid-October to mid-November, somewhere along those lines. This blue line, those are people who actually shopped and switched during last AEP. The green line is people who only shopped, but they didn't switch. If you look at it, this research group went out and said, so during this time period, mid-October to early November, did you shop? And you see over half the people who switched were shopping during that time period. When you get to leading up to Thanksgiving, the next period, it drops off a little bit, but still fully half of the seniors are still shopping from mid-October till right until Thanksgiving. And then after Thanksgiving, you see it begins to drop off because people are certainly beginning to make decisions. Even if you look at this last week of AEP, there's still a lot of people who are shopping. So if there's any time left at all, if you've got any few extra bucks, it's not a bad idea to do something that last shot to maybe pick up those last few people. So another thing that's not on this chart that really goes back to September, there's another chart that shows 25% of the seniors who are going to be shopping during AP actually start looking around in mid-September. If you think of that, the reason is that's when Medicare Advantage companies send out their ANOCs, their annual notices of change. I don't know if you guys ever seen any of those. They are a very daunting document. You can certainly tell CMS has their heavy hand in the way it's documented. So even if the plan's telling great news or no changes, it does cause seniors just enough level of discomfort that they start thinking, maybe I need to start looking around and doing some comparison. So one thing to think about, the way to be in the mail in September when people are starting to shop, it's something you should think about. So also, think about your strategies now and identify your goals and how you want to market it. Like most of you on this call, you're probably doing straight lead generation, and that would be anything where you would send out a direct mail piece or you get internet leads. You do everything you can, but essentially is an offer goes out, a lead comes in, and you contact that person either over the phone or in person and go see them, that type of thing. And that's what most of you are doing. And I think certainly it's probably the most effective way to do it. It's certainly one that I've done when I was an agent, when I ran a career shop, when I ran all sorts of things. That was the primary way to do it, that good face-to-face, one-on-one. We also know that during AEP, it's a great time to do seminars because people are shopping. Listen, I've been in the insurance business for 39 years, and everything I've done in the insurance business has been about generating leads for me, my agents, or somebody, right? So seminars are great. I've done them for financial planning seminars, welcome to Medicare, recruiting pharmacies for Part D, a number of things. I think seminars are great because if you think about it, you get a room full of people. You have maybe 15, 20 people in the room at a time where you can tell all of them the same story at the same time, really get in front of them. So it does work. If you've never done seminars, though, I will tell you AEP is not a good time to start trying to learn how to do them because there's a couple of things that make seminars go really good or really bad. Two things: you can have too many people or not enough people show up. The trouble with some people, they set up a room, they don't really realize how many people are going to come, and some people just can't get in, and it makes them mad, and you lose a potential customer. The other end of the spectrum is you don't have enough people to show up, and I don't know if any of you have conducted a meeting where it's you and two other people in an auditorium. It is really hard to get that energy going. So make sure you're planning your marketing right in doing it. As far as number of invitations you're sending out, it's going to the right people, the right location. There's a lot of science to make those things work. Seminars are expensive. I mean, you got to pay for the room, you got to pay for the mailing. I will say this, though, that if you do them right, it does pay off well. The other is direct consumer, and I tell you, this is something that's really changed probably over the last 10 years. Prior to this direct consumer, it would usually be large insurance companies who would be sending out offers directly, where they would come back in either through the mail or they call their own call center. It would also be, you think about really large call centers around the country that maybe have 200-300 licensed agents on the phone. That's why they do a lot of that as well. What's changed is that now most Medicare Advantage companies and most Medicare supplement companies now have electronic apps that allow you to take applications over the phone. That's what makes direct mail or any other thing you can target a certain area work so well. Most of us were working in our neighborhood because we're leaving our office, our home office, wherever you drive around and coming home that night. So we're kind of restricted geographically about how much we can work. But with this thing, think about this. You could be sitting, you could be sitting in Austin, Texas, working. And let's say you had a plan that was competitive in another county or another area that may be on the other side of the state, like, say, for Lubbock. And if you guys ever been to Texas, it's a long way from Austin to Lubbock. But think about this. If you've got a competitive plan there, you're licensed there, you've got the application to write it, you could direct some target mails into that area, have the people call you and work them over the phone. So it's just really a way to expand your territory and your footprint to try to get beyond there. Works great in AEP, works good in the lock-in period as well. So keep that in mind. But whatever you're doing, just work them all together and think about, I want to do lead gen, I want to do direct consumer. Work about how much you're going to do, which companies will do what, and how you might be able to generate leads for each of those as you go. So it wasn't too long ago that, we could just about not have to be experts on direct mail. So I used to live in Clearwater, Florida, and not too far from the office, and there was this huge community called Top of the World. And it was about 10 square blocks of condominiums where seniors lived. So there were probably a good 15,000, 20,000 seniors who lived in that area. Well, it used to be we could send one mailer out to that whole block, not worry about any messaging, not worth it, just send something out to them, and the response rate would come in. Well, what's changed over the last few years, even in communities like that, there's a lot of differences between the people who are living there. So not everybody's going to respond to the same message. The other thing that's changed is that with the variety of products, certainly with the Medicare Advantage coming in, Medicare supplement products, whatever, a variety of products is different groups of seniors will buy different types of products. So you've got to really concentrate, number one, on your data. Because if you have the wrong data, you're going to just miss your target. And just like that guy that's upside down in front of that sign is, your marketing budget will be upside down very, very quickly as well. So data really is just as important as the messaging, the products you're doing, and everything. So what I'd like to do is just give you a couple of points on mainly the two products most of you will be marketing during this AEP period. Let's use the right data. You want to match it to your campaign. I think we can all agree that the Medicare supplement buyer is a little bit different than the Medicare Advantage buyer. While they're all over 65, while every color in a health plan is, there are some differences. The primary difference is most Medicare Advantage plans, and I think the thing that makes them attractive to a lot of people, is there's zero premiums, low copays, a number of things. So while they have low out-of-pocket initially, the trouble is obviously is they don't really have what their fixed expense is going to be because there's a lot of copays. A lot of people like Medicare supplement plans because it's a fixed cost. If you think about it, If somebody buys a Plan J, they know what their monthly premium is. Their only out-of-pocket expense is going to be what the Part B deductible is that year. Everything else is going to be covered by somebody who's an approved Medicare provider. So there's a little bit of a difference. The primary thing is how you should target your income. So, for example, on Medicare Supplement, during AEP, I would mail 64 and 6 months to age 75. Now, remember, most of us gear our AEP stuff toward the first of the next year, but there are still people who are aging into Medicare Supplement during AEP that you certainly want to start marketing. So if you want to mail Medicare Supplement, I would go 64 and 6 months to age 75 or whatever product you have is competitive. I mean, a lot of Medicare Supplement products, they're competitive to 72, then rates start going up. Some plans, and you all are probably experts at just picking the right plan that have the most competitive product at whatever age, but fix the one that works for you. But expand that marketplace to 64 and 6 months to 75. You need a minimum income because, again, the person who buys a Medicare Supplement has to have the discretionary medical health care income to be able to pay the premium and, in most cases, a Part D plan as well. So I always put a minimum, and I say, listen, the national average is $30,000 up household income. They got enough to do it. That $30,000, that's going to vary. Listen, if you lived in a place like, Del Rio, Texas, that may be $15,000 is what it takes there. On the other hand, if you live in San Francisco, it may be $50,000, which brings up a key point. Nobody knows your market as well as you do. You know what the cost of living is in your area. You know what most things are, that type of thing. So when you call your lead vendor, whether it's us or somebody else, talk to them about that. Give them information. Ask them questions. Say, for example, hey, I want to drop a Medicare Advantage mailer in my market. What's worked? What kind of incomes? Who are they mailing to? That type of thing. Ask questions. Remember, guys, it's your money, and it's no different than when you go out and offer your services to your clients. You're the expert in what you do. Those people are spending their money. They ask you a lot of questions, and you're able to answer those questions because you know what you're doing. You need to do that with your same vendor. Again, whether it's us or somebody else, ask them questions. What's worked? This was in my marketplace. What do you think? And don't just take some off-the-shelf thing that they're going to give you, although most of them have a good idea. Work with them and talk about that. The other thing, particularly during AEP, generally speaking, that when you're mailing, particularly older ages during AEP, both people in the house are going to be age 65 or older and could qualify for it. Well, we found out is there's no reason if you've got a husband and wife in the house who both are qualifying for Medicare and would be on a mailing list, there's no reason to mail both of them because only one of them is going to make that decision, and it's typically in healthcare buying, it's typically female first. So we always say when there's two people that in the same household that qualify, only mail to one. And what that does is that extends your marketing budget more. So into that household, you can take that one that would have gone to that one person, use it to mail to somebody else. That may be a reason sometimes. So we get lots of questions sometimes. We have some competitors out there. People will call us and say, hey, I ran some counts, and this is what it is. I'm looking at your counts. Yours are less. Why? And that's the reason we're only mailing one per household, because you'll pick up more households, which will get you those people. Again, default to female first. Medicare Advantage, a lot of the same thing. The only difference is that you want to move that age to 64 and 9 months. So you want to be able to assure that when you're talking to some people during AEP, they will at least be 65 on January 1st. The only other difference I would do is I would lower the income to zero, because one of the things people like about Medicare Advantage is it works well for low-income folks, which is great, but it also works for other people who are maybe not so much care about their network and just really maybe they're coming off group insurance or used to co-pays or used to that type of thing. It works for them as well. I would recommend, though, on the upper end, you cut that income off at $125,000. The only reason I say that is that at Kramer Direct, we mail millions and millions and millions of pieces a year, mail a year. In another division I run, we mail about 50 million pieces of mail a year. We have a lot of experience on what people respond to. It's interesting. I don't care if it's in Ohio, Kansas, Nebraska, where it is. One thing we know is on Medicare Advantage, when that income goes over $125,000, response rates drop off like down to nothing. It's like a cliff dropping off. So why would you spend money on a group that's not going to respond? So just like on Medicare Supplement, where you don't want to mail to somebody with no income, on this one, we highly recommend you cut it off at $125,000 income because you just don't get the return for your dollar you do on the otherwise. And again, one per household, default to female first. So then once you figure out what you're going to market and who you're going to market to, the next thing that you want to talk about is what medium and sort of where you should spend your marketing dollars. I know this chart's kind of busy, but if you look at it, essentially what it shows is this green is 2000 last AEP, this blue is the one before that, and the orange is the one before that. So it goes back 3 years. And again, this is one of the things that this research company looks at, and they go out and survey people. They've been doing it forever, and they say, so where do you go to shop for your health care during AEP? And you'll notice that year in and year out, the number one has been direct mail from other insurers or from not their current insurer, which would be stuff that we're trying to do. And you'll see that for the most part, it's 46%. It was more than it was last year. There was a lot of mail sent out 2 years ago because there was a lot of disruption in the marketplace. If you guys remember, there's a lot of movement. Plans were pulling out. Part D premiums were changing, a number of things. That's why they were there. But if you look, direct mail pretty much outshines everything year in and year out. The only thing that came close this last year was TV ads. Listen, and it's not where you would go out and buy a TV ad on your own. There are companies out there, and I guess you guys have all seen this. The one that's on TV that almost seems incessantly is the guy, the doctor in the white coat with the stethoscope around, talking about, if you qualify and you're over age 65, there are plans out there that give you more benefits. Those are generic ads. And what those people do, they run them, and then they sell them to some of those large call centers, some other people as well. So a lot has given rise to that, so a lot of people have seen it. Most of them on this call don't have the ability to do TV ads and sometimes don't have the budget. And what this shows to me, again, 2019, if you have a limited budget, you'll hear this theme a lot, direct mail is still the best way to go and the most effective way to get your response rate and get in front of people. Look, I wish I could give you a perfect lead. And my definition of perfect lead is really pretty simple. I want to send out 1,000 mailers. I want to get back 150 responses. And every door I knock on, the person standing there with a checkbook in one hand, pen in the other hand, and saying, thank goodness you're here. Sign me up. Let's get started. I can't do that. If I could, I wouldn't be doing this, but I can't do that. You got to remember, and the wise cut it off, a lead, really all that is, it's a way to start a conversation. So all you're trying to do is trying to get in front of somebody that you know has a reasonable interest in it because they've responded to a mailing. They know pretty much that you're in your marketplace because you've done your data right and you've got the product you want to sell them. So remember that. A lead's not a way, it's not a sale, it's a way to start a conversation. And there are a couple of ways that certainly you can go with that. We'll talk about that. So Medicare Supplement, I think you need to think about mailing Medicare Supplement. We know that September traditionally is always the biggest mail volume of the year because people are trying to get out this type of thing. Remember, you can sell Medicare Supplement during AEP. And this is a typical ad that goes out. Even though that says turning age 65, it works. It's basically got Medicare Supplement comparison, registered document, we're going to bring you a comparison. You can actually get that in the mail the end of August and in September and get leads back and what have you. I am not in compliance, and I'm not going to give compliance advice, and I'm not going to try to tell you that I know everything there is to know. But listen, you all know that CMS regulations do allow you to sell other products during Medicare Advantage. And if during the course of that conversation Medicare Advantage comes up, you're going through your compliance training right now, you know that you can get a scope of appointment and sell them. So that's a way to really start getting in front of people. Also, remember, September, people could certainly start shopping and start buying ahead of time as well. So that's one good way to get in front of them. Medicare Advantage, we all know that there are certain restrictions, again, about when you can market and not market. So you want to be in homes like starting October 1st. This is a very generic ad. Just talks about annual enrollment healthcare benefits. As a beneficiary, enrollment's coming up, making the wrong decision, it could cost you thousands of dollars. Honestly, Medicare Advantage mailings typically will get a lower response than a Medicare Supplement mailing. And And the reason is, if you look at a Medicare supplement mailing, you've got to put a disclaimer on there that says, hey, this is not from the federal government, we're not part of Medicare, that type of thing. On a Medicare Advantage, although CMS is beginning to change some rules, is, you have to put more information about disclosure. You have to put your name in the ad. You have to do that. And also, you have to use permission to contact, which a response rate like this would give you permission to contact. So information on Medicare Advantage Part D, information on Medicare Supplement, information on Med Advantage or Medicare supplements. So obviously, they know why that's coming. So traditionally, this will give a little bit lower response. I will also tell you is that there's a lot of mail out during AEP, and while our response rates are similar to everybody else's is, generally speaking, a lot of times you could see a drop, a little bit of a drop in AEP than if you marketed aging in during the rest of the year. But that's typical on the industry as well. The Medicare Advantage leads are, again, in there. The other question that comes up is also, what should I put in my mailing? There's really basically two broad categories. First of all, there's a generic mailing, what this is. If you take a look at this piece of mail, first of all, it's not branded. It doesn't have your name on it. It doesn't have an insurance company name on it. It doesn't have your picture. It doesn't have anything. It is a very plain generic mailing. It's got no branding. And when it comes back, you can see again, it's asking just enough information on it. It said, listen, complete this, and we'll be back within 5 business days to receive a price and benefit comparison for your age and zip code. You can also do this with a Medicare Advantage piece as well. Generic mailings typically give a higher response rate because they're just not as non-information, they're not branded, that type of thing. But while they get a higher response rate, generally speaking, you will have a lower conversion rate. So with this type of lead, you'll get more leads will come in, so your target audience will be larger. Generally speaking, you won't sell as many, you won't close as many as you would with a more generic mailing. So, really what you want a lot of leads to fill up your pipeline and close what you can, or you can as well do a more branded lead, where it's got color, it's got a name on it, it may be colorful, and it really looks more like an advertisement, it may have more detail, this type of thing. This will generate a lower response rate. However, you're almost using the mail a bit to maybe, pre-qualify and pre-sort, so that people have a better idea why you're coming, so you should have higher conversion rate. I get asked all the time, hey, I want to send out a mailing. I say, great. Here is our general mailing we recommend. You say, no, listen, I'm going to put my picture on it, I'm going to put my agency name in it, I want to put all of these things in, I want to put a premium in it. There's all kinds of things I want to do because I know this is a really great premium. Well, I respond to them and say, well, listen, first of all, are you the only insurance agency in town? Does everybody know who you are? The guy says no, and I said, so really, put in your name, put in your picture, really doesn't help you. In fact, many times it'll hinder you because they'll see it's just an advertisement and throw it away, number one. The other thing about putting prices in, particularly Medicare supplement premiums, the thing about putting prices in ad, my personal philosophy is while you may think $95 is a great monthly rate for a Plan G, if somebody's just shopping for the first time, they have no idea what a premium is. They don't know if it's a good deal or not. They may think it's really, really expensive, so I think it'll hurt your response rate. I think, again, to get the biggest bang for your buck, generic is the way to go, get more responses, and you will get in front of people and be able to sell them. The next thing we'll talk about then is multi-channel marketing. We spend so much time talking about direct mail. I think it's important to talk about other things also. I think it's important to talk about other things that are available to you. Direct mail, again, is a great way to go. And I always tell people, if you've got an unlimited budget and you have expertise, do everything you see there. Because we do know that if you do direct mail and you follow up with social media or newspaper and TV, you will see a lift in your response rate. There's no question about that. The trouble is that those are expensive as well. So direct mail we know works. Social media, and that's really kind of Facebook if you think about it. Facebook is a great way to advertise. It's very difficult for you as an individual producer to do Facebook ads because it's expensive to get in. You got to pay money up front. There's lots of things. Some companies are out there that do sell Facebook ads, and they do tend to work. Something to look at. Internet leads, I'm sure at some point everybody in this call has tried internet leads, mainly because they are inexpensive, and they can work. But I know this about internet leads. You have to react quickly. Because even though they may be selling you an internet lead that is exclusive to you, and by the way, ask that question on internet leads when they say exclusive, sometimes exclusivity means only 3 other people are going to get it. But the internet lead, even if it's exclusive to that provider, remember, if somebody's on the internet looking for they're going to search other sites as well. So you got to worry about other sites responding and getting ahead of them quickly also. So when you get an internet lead, respond quickly. Newspaper, look, I grew up in the newspaper business. I'm of the age where I remember when newspapers used to be there, that type of thing. And if you live in a community where there actually still is a newspaper, I think it's a good thing to use in certain circumstances, particularly in our marketplace. Look, true, people turning 65 are really more social, that type of thing. But even people turning 65, we grew up in households where the newspaper was read every day, and a lot of us still do. I don't think newspapers work just for a general ad, just to put an ad in there that says, "Hi, I'm Chris York. Here's my insurance agency. These are products I have office. Please call me." They're not bad occasionally, but I think where they would work, if you're doing like a specific event, like if you're going to be at a health fair, if you're going to be doing some sort of meeting, that type of thing, I think it works to maybe use that to supplement your direct mail advertising as well. And it's the same thing with TV and radio. TV, radio ads you can buy. Certainly work with your local stations. They're not cheap. I mean, they're not inexpensive. No, they're inexpensive. What I'm trying to say, I'm sorry. They do that. But again, it's one of those things also, I think it shouldn't be your primary, it should be an added. I also know that, again, there are companies out there that do sell TV leads, that type of thing as well. So the bottom line is, again, if you've got unlimited budget, use all of those. If you've got a limited budget, and this is not just Chris York at Kramer Direct who sells mail this, you look at any industry studies, direct mail is the way to go. So again, I'd love to use us. If you use us, that'd be great. If you have another partner as well, I hope some of this stuff has helped you. Which really leads me to my next slide. I think the most important thing that you can do is you find the right partner. By find the right partner, I'm talking about a lot of things. So again, if you take a look at the Beatles, they were great partners together. It was, the Beatles during 1966, 67, they just worked together magically. And toward the end of like 68, 69, they just sort of began to fall apart. So they weren't, while they still worked together, they weren't great partners. You want to find a great partner. Number one, your first step is finding a great FMO to work with, like obviously Art Jetter and Associates. Work with them. They're a great FMO to work with them. The other thing is your lead vendor partner. You want to find a good partner there. As I said before, ask the right questions. And these are a couple of questions I would ask them. Number one is, how often do you scrub your list and renew your list? If it's less than 30 days, I would go to another vendor. And the only reason I say that is we live in a very transitory marketplace. That's our marketplace. Old people die, people move, that type of thing. Unless that list is refreshed at least every 30 days, there's going to be a lot of people on that list who your mail won't deliver to because they're simply not there. Other thing, ask them, how does the mail go out? On that postcard show that I showed you, we go out first-class mail, and the response cards come back first-class mail, which means that when you place an order, I'm in the home 2 to 3 days later, and because the postcard that's coming back with the BRC on it, the business reply card comes back first class, we begin to get responses back in 10 days. So generally from like 10 days to 21 days, that's when the majority of your leads are going to come in. The reason I say that's important, during AEP, you have to be at home at specific times. You also, if you want to do a last-minute mailing for AEP, you want to make sure it gets in the home first. So knowing that when you place an order, it's in the home 2 to 3 days later, gives you some benefit to do that. So check into that also. Also ask them, is they going to protect your mailing list? So for example, we at Kramer Direct, we do not remail the name that you mail for 60 days. So if you call up and you order a Medicare Advantage mailing or a Medicare mailing, somebody else calls in and wants to mail in the same area, we're not going to remail the name that you mailed for at least 60 days to give you plenty of time to work your lead. If you think about it, that means pretty much through AEP, you're going to have exclusive use of that name. So we do that as well. Ask them how your leads are delivered. Most of them should have some sort of electronic lead portal to give them back to you every day. Look, so the mail comes back. So for example, all the reply cards come back to us. We then scan them in. We set you up with a secure portal in your name only that you only can see, and the leads are uploaded to it every day. So find your right partner and make sure that they're doing stuff. Ask the right questions, guys. That's what you need to do to make sure, again, that you are getting the biggest bang for your buck and getting what you deserve. And the last thing we want to talk about is, before I turn this back over to Kristen, is how are you going to order leads through Kramer Direct? And again, I'm having a little bit of issue here, hopefully. So it's really simple. So one of the good things about working with Art Jeter and Company is that they made it really simple for you. All you do is you call our 800 number and you say, hey, I'm with Art Jeter and Company. They're my FMO, and I'd like to order a mailing for them. Right away, we know that triggers a special rate that we've given for them. You choose your area. You choose the demographics that you want to mail. We'll work with you. And the basic demographics will include age, income, gender, address. We exclude military. We do a lot of things for a lot of things. So we'll do that for you. We're then going to email you the samples and the counts so you can see what they are. Once we receive your order and the order is placed, we go in the mail. And like I said, it goes to the mail 2 to 3 days later. If you're not doing business already, when we receive the first email back from you, you'll get an email from us that says, hey, congratulations, Chris, your first leads come in. Here's a website to go to. Here is your username, and here is your unique ID number for you to get in and access your lead portal. And then we have training video all over it, and that's how you do it. One of the things also is that we have agreed to a special rate as well. So if you were to call Kramer on your own and say, hey, I want to order a mailing, we pretty much quote you, the mailing is $470 a thousand. We occasionally do run specials on a monthly basis that are for certain types of products. They're not for any type of product, and we generally charge this $450,000 rate. But for you guys, because you're licensed with Art Jeter and Company, your everyday rate is $450 a thousand. That $450 includes the list, includes the postage, includes the mailing, it includes us processing the leads, it includes us giving the agent portal, it includes everything. So no matter what, whatever rate you see or you hear on our website, when you say those magic words, and I'm with Art Jeter and Company, you qualify for the rate automatically. And we do make it easy as we can for you to do business with you. The only thing we do, just so you know, we charge an additional $20 a thousand if you mail exclusively returning 65, and that's simply extra postage we have to pay because we don't get the postal discount. We just pass that through a cost. But that is a great rate. You will enjoy doing business with us. Kristen, I think that we've reached the point where all we're going to do is just remind them again of the 1,000-piece mailing. Again, congratulations, you guys have qualified for the mailing. It includes everything we've talked about this so far in our webinar about the double postcard, that type of thing. I'm sure that Kristen or somebody there will pick the winner tomorrow. We'll announce it, and then what we'll do is we will work with you on the mailing you want to get out and get going. That's our contact information. I'll obviously put it up there, and I'm sure the marketers there have the information as well. Again, we would love to do business with you. If you're doing business with a vendor you like, congratulations. Obviously, you can keep working with them. I just hope some of the information that we gave you here today helps you with your budget and luck. So, Kristen, I'm done. If you want to wrap it up and see if there's any questions, I think we're good.
Great. Thank you, Chris. And, you know, that was a ton of information. And I know in my past life, you know, hearing from agents that Kramer Direct leads are great. They've had great success with using those leads. So I know that working with Chris and his team, they will definitely help you, you know, make this AEP very successful. So if you have any questions and if you are not yet contracted with us, make sure you reach out to the marketing team here, either via email at seniorhealth@jeter.com or by phone by calling in at 1-800-228-0008. And one of the marketers will be happy to get you going. Again, you need to be contracted with at least one of our carriers in order to qualify for this free lead mailing. So, you know, as many of you know, and as you know, we do work with well over 100 different insurance companies across all lines of business. One huge key factor is that we have a underwriter on staff that is here to help you. If you've got any type of, sticky type of situations, health issues, we are here to help in that regard. So here's all the great things about Art Jetter and Company. We are celebrating our 40th year in the business this year. So that's great news as well. So we are here to help, as I have said. So let me just peek to see if there are any questions. I do see one. So a question did come in, Chris. Any discount for larger amounts of leads, saying 5,000?
No. The rate that Kristen has beat me up on would be that discount. So you're going to get that discount rate where you do 1,000 or 5,000.
Okay, great. And we will draw the name tomorrow for the individual that won the leads. So if there's any other questions, we'll just give it another minute or so. Okay, another question came in. Do you have a mailer if I wanted to do a meeting?
Yeah, we do, as a matter of fact. I mean, so one thing I did not mention, we do have, again, use that same format where we do have mailers if you want to do a meeting. The other thing we are able to do as well is we will work with you on a customized mailer. So if you've got one that works, we have to take a look at that and do that. But yeah, this double postcard format, by the way, works really well to do meetings also.
Wonderful. Good deal. Okay. Well, if there's any questions that you may have after the webinar here today, tomorrow, next week, whenever, feel free to get with us, let us know, and we can help you out with that process so that you're well prepared once October 15th arrives, which it won't be, it'll be here right around the corner. And so thank you, Chris, again for taking the time out of your day.
Glad I could help, and thank you for giving me the opportunity to do this forward. I look forward to working with all you guys. All I can tell you, listen, good luck and good selling. I hope you have the best AEP you've ever had.
Okay. Oh, another question just came in. Do you allow more than one in an area?
Yeah, and the way we police that is that, again, like I said, we protect the mailing list for 60 days. So you're going to order a mailing from us, and whether you order 1,000 mailers or 5,000 mailers, we won't re-nail that name for 60 days. So while the area is not protected, the names that you mail are protected.
Okay. Well, good. Well, again, thank you all for joining the call today. I really look forward to working with all of you, and let us know if you have any other further questions. Thanks, Chris.
Thank you. Bye.
All right. Bye-bye.